If treatment has made you infertile, what kind of options are there for you to have a family?
It's much harder if you haven't stored embryos or banked sperm before you start treatment. Then you're looking at actually what are called third-party options, and you'd be considering things like surrogacy or donor eggs or donor sperm, or looking into things like adoption or fostering.
Is there any chance of regaining fertility if you come out of treatment and initially it looks like your fertility is dropped? Does that commonly come back again, or?
So often fertility does come back, and that's actually where it can be really difficult. So for certain things, we will know that people will definitely be infertile. They've had a hysterectomy, they will definitely be infertile. For women who have had, say, breast cancer, or men or women who have had a hematological malignancy, then it's a bit around uncertainty around fertility. And in many cases, the likelihood is that it will come back, but they're having to live with that uncertainty because they don't know that it definitely will come back, or that it won't be impaired in some way when it does come back. And those people may still choose to do fertility preservation procedures before they start treatment in case it doesn't come back. Others feel they'll do more a sort of wait and see because the likelihood is that it will come back. But it's a difficult group. It's when you're dealing with the uncertainty around whether you are fertile or not.
And how can you test for that? How can you test whether you are still fertile or not? Is it related to, so for women, for example, is the lack of periods or having periods, is that a good indicator of whether you're fertile?
Periods aren't a particularly good indicator. People sort of think because they're having a period they're fertile, or if they're not having a period they're infertile, and that's not necessarily the case. I think they're a marker, and people feel reassured if their periods have come. If your periods don't come back at all, then that's particularly negative. But they feel when they do come back, that's better. You're not sure though if they do come back how good the eggs are, or whether you're ovulating appropriately. There are some tests we can do. For men it's much easier because they can just give a sperm sample and you can check whether the sperm moves okay, the quality of the sperm, that sort of thing. For women it's actually much harder. There is something called anti-Müllerian hormone, or AMH, which gives a sort of guide as to how fertile you are, but it's not an exact science. And you can do ultrasounds to look at how many follicles and things there are. What there is some talk of doing is that you should check people's AMH, their anti-Müllerian hormone, before they have, if they're going to have chemotherapy, before they have chemotherapy, because then when you check it after they've had chemotherapy, you can see what the impact for chemotherapy has been for them. Again, it's not a definitive, but it can sort of give people a guide that their fertility is the same as it was before, so not to worry, or that it's waning, and perhaps they should think about conceiving sooner rather than later.
Is that something people can request? Like, would you go to your GP and be referred for something like that for testing, or?
Your GP could do that. It's a simple blood test, so your GP could do it. There will be implications around funding depending on how they put it through. Equally, I think in any of these cases it's actually better to be asked to be referred to a fertility specialist or a reproductive endocrinologist, because they actually know. So you're actually going to, in the same way you went to a cancer specialist who dealt with your sort of cancer, if you're wanting to speak to somebody about fertility, you go to a fertility specialist.
Hormone fertility treatments, are they safe to have after you've had cancer? If you know, to boost your fertility, if you wanted to go down that route, is that something that's safe?
It's again a really difficult one. The evidence would suggest that it is safe, but sort of psychologically, for a woman who has had a hormone-sensitive cancer to then be feeding extra hormones into her body sort of feels a bit counterintuitive, and it can feel that it's hard to sit with them. Equally, some health professionals feel that you shouldn't give hormones. You know, they won't give women oral contraceptive pill, or people who've had certain cancers that are not offered HRT. So there's often a feeling in the medical profession that you shouldn't. But the evidence is minimal that there is an impact. And I think as as treatment goes on, we're getting more and more effective ways of going through things like IVF without having to use the huge hormones that we say did in the 70s and 80s when IVF, for example, was first coming around.
Yeah. So are there any fertility treatments that actually are known to cause cancer or have a risk of causing cancer?
There has been sort of some research that suggested if you had IVF, because you were hormonally stimulated, you hyperstimulated the ovaries, that increased the risk of ovarian cancer. What is difficult though is actually, is there some link between being infertile and ovarian cancer because there's some faults in your ovary?
Okay, yeah.
So it's very difficult to actually clearly pick that out.
Okay.
But it did make people worry. And again, it's that sort of thought, you're making, the more times you ovulate, the more chances of something going wrong, almost in ovarian cancer, for example. So if you hyperstimulate your ovaries, then there was felt to be that risk. I think often as well, when people have been diagnosed with a cancer, you look back at all those what ifs.
Yes.
And people have heard about HRT and increased risk of breast cancer. So in people's own perception, they have that thought. And because there's no clear evidence when consenting and discussing hormonal stimulation for fertility, doctors may say, we don't know this, and they raise that, we can't say for definite that this will not cause cancer or make your cancer worse.
Yeah. Okay, thank you.